A bill going through the legislature touts better outcomes for all Californians and is endorsed by the state's largest nurses association. It would create a single-payer healthcare system in the state of California. Now, we've talked about the financial and tax implications, and there is already opposition forming to the bill because of the proposed taxes needed to fund the system. But we spoke to a Northern California medical consultant about what the actual healthcare would look like. Paul Seegert from PCS Advisors, he understands the impact to healthcare that might come from this bill. He's watching it very closely because he consults with businesses on their healthcare coverage for their employees. He says right now there are two kinds of payers for healthcare: government with Medi-Cal and Medicare, and private, which would be like employer-sponsored insurance.
They can treat a patient who's a government payer and lose money because they're going to make up for that shortfall on private payers. Hospitals and other providers in our system do not break even in many cases on government payers. They need 118 or 120% of what they get from Medicare, from Medi-Cal, from Medicaid to cover the cost of providing that. So then they turn around and someone comes in with employer-sponsored coverage and they overcharge that client to make up for it. So that holds the system together as we know it today. And what they're proposing in California would be eliminating that source of revenue, these employer plans and private plans that make the whole thing work.
So right now there's this balance between public payers and private payers, with private payers paying more. Right. So they're kind of covering the public payers.
And that would go away.
That would go away. So with more people to treat and hospitals then seeing a reduction in profits, wait times would increase, and we'd have something similar, he says, to what we currently see in Canada.
You can't get to where they're trying to get without seeing a reduction in quality. You're either going to ration healthcare by line or by price. We currently do it by price. And we would start to ration by line, and that would mean if we took the wait lists from Canada as percentages and applied them to our population in California, you'd have 700,000 people waiting for care for things today that they can get virtually immediately in many cases.
Seegert believes this would cause an even greater divide between rich and poor because the rich would take advantage of the medical tourism that would pop up just beyond the California border, again, looking to Canada for that example.
The U.S. healthcare system is a safety valve for Canada. 70,000 Canadians a year come to the U.S. to get care that they don't want to wait for in Canada. Those that can afford it, hop the border, pay cash, get their knee replacement, get their heart surgery, get their cancer treatment. We would see the same thing happening within our own country and across state lines. You'd have medical tourism popping up in Nevada, Arizona, and those that can afford it would be getting that, buying coverage there, and those that can't would be subjected to what would become one of the lowest quality health systems in the country.
The whole purpose of the bill is to try to make sure that everyone's getting decent care and that there will be better outcomes for everyone. And he says what could happen, what he believes is likely to happen, is that it'll create more of a divide between rich and poor.
Of course it will. I mean, it doesn't take a rocket scientist to figure this out.
Well, and you'll have all these hospital systems just popping up right in Nevada, so you can just drive right in Arizona even.
And the wealthy will go where they get the best health care.
Right.
By the way, you go to the Mayo Clinic in Rochester, Minnesota, the walls are lined with bricks that are engraved by oil barons who have flown there in their private jets to get health care.
Well, oh, I'm sure.
They go where they can get the best health care.
Right. Which is why we have, thousands and thousands of Canadians that come down here. Right. Because when you have to wait 6 months for a surgery.